Hello, everybody. I am going to be talking to you today about developing a curriculum map for your simulation education program. Whether it's in academia or whether it's in practice, you can develop a curriculum map for your program by looking at either your education program within your hospital environment in practice, or if you are looking at a specific course within an academic environment. So what I'd like you to do first is to download the curriculum map worksheet that I have a link to so that you can follow along with this video on curriculum mapping. Remember back in April when we talked about the Match It game with the 7 phases? We're going to move past that and we're going to go right into curriculum mapping and how you look at your program and start with outcomes as opposed to starting with the SimMan and the equipment. Historically, what we have done, and you should remember me discussing this in class, is we got SimMan out of the box, and then we decided what scenarios we were going to use, then what courses or program we were going to place that in, and then finally looked all the way at program outcomes and what outcome or patient outcome it was going to fill that gap. Ideally, what we want to do is go in the other direction. Most programs have already developed their scenarios, so you, with your curriculum map, are most likely going to complete the last column on the right first because that's probably what you already have. If you don't, this is actually ideal. If you're just starting your sim program, then you can begin with the planning phase and you will then look at what your program outcomes are and then be able to move forward and see where simulation fits best within your program. You really should be looking at the goals that you have within your education curriculum. Again, I'm speaking about practice and academia. Look at the goals, then look at where the gaps are in your education program, and then look at where simulation actually fits best. We don't want to be doing simulations when there really isn't a need because we can get that or help our learners within a clinical setting to gain that knowledge. We really want to use simulation to its best advantage. And then look at concepts. Concepts are really important. So as you look across this worksheet, we're going to first look at what course you're going to be placing this simulation in. So I put here a med-surg course or a med-surg unit, perhaps your residency learners, and then move forward to whatever the big outcome would be. So a large outcome, I have populated this for you so it will give you an example. The program outcome is, and what I put here, upon completion of the program, the learner will provide safe and effective care. Then you move to the course outcome, so you're getting a little bit more in detail. They're going to apply standards of patient safety. Look at the concept and the threads that you want to have within your simulation. And here I put safety, communication, and priority of care. And then you move into the simulation. So I put the title, and the simulation for the title here is Care of the Patient with a DVT. And the name of that particular patient is Vernon Watkins. And many of you know who that is because that's an NLN evidence-based peer-reviewed scenario. And then these are the objectives that go along with that particular simulation. What I'd like you to do is identify only one program outcome and only one scenario. So when you come to us in November, if you could have this completed, and we'll do some talk and we'll do some work on your curriculum map. These are going to become really important as we move, and a lot of the accreditation bodies are going to be looking for how do we map our simulations and program outcomes. So Joint Commission may look for that in your residency programs or even in the programs that you have for education for your staff. And then in academia, the ASIN is going to be looking for that, as well as CNEA when they come and accredit nursing programs. What I'd like you to do now is take some time. Just look, I only want you to complete one so that at least we can have a discussion, and then we will then be able to help you look at how you can map all of these simulations back to your programs of study. So good luck, and I will see you in November. Thanks. Bye-bye.